All right, we are live, and thank you all so much for holding on. We did have some technical issues right now with our live stream setup, but they are now corrected. And we are very excited to welcome you to another Courage session today. We have some really special guests with us, the new kids on the block. We have the Texas Tech University Health Sciences Center El Paso, Woody L. Hunt School of Dental Medicine joining us today. I really hope I got that name right. It's a mouthful, but hopefully you all can correct us. Before we introduce our guests, I do want to introduce the team here. My name is Enrique Paso. I am the Associate Director of the Texas Health Education Service, and we are housed in the TMDSAS office. And joining me today is Dr. Beck.
Good afternoon. How is everybody out there? I'm the advising coordinator for the Texas Health Education Service. And I served as the director of the Health Professions Office at UNT for 18 years. I just retired from there in February. So I'm happy to be on with Enrique this afternoon.
Thank you, Deb. And joining us today, as I mentioned, we have some special guests. We'll start with Dr. Black, and then we'll go with Ms. Goldfarb. Dr. Black, would you mind introducing yourself?
How are you? I'm Dr. Rick Black, and I'm happy to be here. I'm the dean, the founding dean of the Hunt School of Dental Medicine, and thought this was a great opportunity to join the TMDSAS Courage broadcast, as well as some admissions advice, but a little bit about the school when I get an opportunity. I'd like to introduce our Senior Director of Admissions, Sid Goldfarb.
Hello, I'm Sid Goldfarb. I'm the Senior Director of Admissions, and I'm actually coming up on almost a year here. So we are very excited to get this show started because we've been talking about May 1st and June 1st for a while now. So we are excited to really get students on campus eventually.
Great. And as we mentioned in other broadcasts of the Courage sessions, these sessions are here because this is a weird application cycle. As it is, we have a lot of impacts caused by COVID-19, including delays of tests, assessments like the DAT or the MCAT. We have activities that have been canceled over the summer. Just so many different things that have impacted you and your preparation to becoming a dentist or a physician or a veterinarian. And so we're bringing the schools to you to address your questions. So if you have any questions that you'd like to ask of our panelists today, please do share them in the comments section. I am monitoring those, and we'll be curating the questions as they come in. And so first question, I think, is going to be directed to Dr. Black, and I'm sure you're very well versed in this, but would you mind giving us a brief history of the establishment of the dental school?
Well, thank you, Enrique. This is the newest school. It's the first school to be built in over 50 years in Texas. Texas has 3 outstanding dental schools that are 2 or over 100 years old, and UT San Antonio is over 53 or 4 years old. So the Texas Tech system, university, Board of Regents, the people of Western Texas, the people of El Paso all got together and said, let's try to make this happen. And it's been 6 or 8 years in the making, and it's very exciting. El Paso is the largest city sort of in Texas Tech system area. And, we have a lot of terrific people go to dental school. In particular, if we're talking about Western Texas, the problem is we just don't get them to come back. Almost 70% of all the dentists in Texas practice in 5 counties, Fort Worth, Dallas, Houston, San Antonio, and Austin. And so it's our goal and our mission, and the mission of the school is to provide for people in the borderland and in Western Texas. Hopefully we're gonna have folks that apply from that part of the state that will get a little extra attention from us, because we're in hopes that they will practice in Western Texas. So the philosophy of the school is very much in public health. You're going to get a public health certificate, 16 hours credit by being a student for 4 years at Hunt. You're also going to be in a very high-tech, high-touch school where you'll be starting in the clinic very early. You'll be using almost exclusively a digital workflow. And one of the things I mentioned is you'll also be learning Spanish, conversational medical Spanish, which we think is very important. So those are just some of the highlights of the curriculum that we're going to be bringing here. We're situated at the Texas Tech Health Science Center campus in El Paso, where there is a large medical school, large nursing school, a school of biomedical sciences, and now a dental school.
Grown significantly. I have to admit, I'm going to be a little biased in this session. I'm doing everything I can to not talk to them about the amazing food in El Paso. I am a child of El Paso, and so I'm really having some wanderlust with Ms. Goldfarb's background right now, seeing the mountains and a really blue sky. It's breathtaking. I'd like to follow up on some of the questions that I know a lot of students have about El Paso. And a lot of them have to do about the location. I mean, obviously, folks know El Paso is on the westernmost tip of Texas. And there are two really key concerns that I think a lot of students have. One is the kind of preparation for an environment like that. A lot of folks do get some sort of culture shock when they go to El Paso. And unfortunately, I've heard a lot of misconceptions about the city. And so if you all have any feedback on that. And then secondly, I wanted to ask about, you mentioned that speaking Spanish is going to be part of the curriculum. Does that mean that students that already speak Spanish or have taken any preparation in other languages might have a leg up on other applicants?
So let me address the just sort of the idea that we're here on the border. You know, our location here on the border is what makes us so unique, and it makes our city what it is, a warm, inviting, welcoming city. And so I think the idea is that when people come here, they have absolutely no idea what they're walking into. And I hear over and over and over again that they've never experienced such warmth and such support in our city. And so we also hear quite often that we're right here on the border with Mexico, with Juarez. You know, what are their concerns about the violence? And just to say that in the last 5-8 years, El Paso has been ranked first and or third, second or third in the top 3 as far as safety in the United States. And so there are no concerns. I think a lot of times, many of what you see on TV and different areas like that, or in the news, is sort of not necessarily completely accurate, especially for the city of El Paso. So we are an amazing place to be and to live. And as far as the culture shock goes, yes, I would agree with that. I think a lot of people experience that. But I think one of the things that makes us so unique is that in El Paso is that we are so accepting. Because there is such a diverse group of people here in El Paso, it's not ever anything that is really looked upon as anything that's negative. I see it as a big positive. Love the idea that you can be walking down the street and you can be hearing Spanish, you can be speaking Spanish. I speak Spanish. All 3 of my children are completely biliterate and bilingual as well. And so I think that's just a wonderful place to be. We talk about in our world today the need for cultural awareness, cultural empathy in a sense, and working in that healthcare field. You know, we know that one of the biggest barriers to access to healthcare are cultural barriers. And so, you know, we want students to be able to do this when they get out of school, but then we're not necessarily teaching them when they're in school. And I think that that is something that we find to be very important here at the Hunt School of Dental Medicine.
I think also, Enrique, El Paso is almost 1 million people, and it's a very it's a modern city. It has almost all the amenities of any place else, but it has a charm of still sort of being a small city feel to it. Geographically, you see those mountains behind you if you like to hike. If you like to be in the mountains to ski or do winter sports, we're 2.5 hours away from that. So it's a difference that you certainly don't miss the traffic in, say, Dallas or Houston or Austin, for sure.
And we have 300+ days of sunshine a year.
Right.
And that's just amazing. And then as far as, I've had this question a lot, you know, from applicants, if they don't speak Spanish, is that going to be a negative against them? Do they have to speak Spanish in order to apply? And the answer is no. There's no scoring system that's going to include whether or not they speak Spanish. What we are looking for, though, is you know, a diversity of experiences, diversity of thoughts with students that come, because they do have to have some experiences and some open-mindedness to understand that this is going to be a different experience probably than what they're used to. But we think it's going to be an exciting experience for them. So students will be grouped according to their level of Spanish, and they'll be given a diagnostic. And so we have lots of students that are completely fluent and bilingual, and they're up in the higher level Spanish and the highest level of Spanish. And so, for example, oftentimes they may serve as patients for the other groups, and the other groups have to use their Spanish skills to be able to communicate and to sort of recognize the difficulty in communicating in a language that you don't fully understand, and to be able to get them to sort of empathize on that other side when they have a patient that doesn't necessarily communicate in the same language.
I love the idea of that collaborative learning environment where, you know, everybody's using their skills to help others within their own class. It's really refreshing to hear. Too many times we see excessive competition, especially at the pre-dental, professional school level, and you know, honestly, that doesn't translate over into professional school. So I'm excited to hear that the curriculum really incorporates the collaborative learning environment, and I'm excited to hear how your students do after this first year.
You know, Enrique, we're a pass-fail institution, which also lends itself to the collaboration. I mean, we know that rising tides raise all ships, and so what we are looking for when we have students, we want exceptional clinicians. And the way that they can become that way is to learn and to teach each other. And if we make it a competitive environment, that teaching and learning from each other is not going to be where it needs to be.
Mm-hmm. Exactly. Well, we do have a few questions that have come up so far, and I want to make sure that we are addressing those. The first question comes from the TMDSAS page. How many students will the program be taking their first year?
The program will be taking 40 students the first year, and then the second year and thereafter will be 60 students.
It's a relatively large cohort. All right. We have another question. This one seems to be more around the TMDSAS application, a specific question about somebody who took a GED, and they're asking about how to enter that in their application. On the application handbook, there's actually some guidance about how to enter your GED. I believe your concern is around entering a class size, but since you took a GED, there is no class size. So you can enter that as unranked, and class size would be 1. And if you have any other questions about that application, please do reach out to TMDSAS and they'd be happy to help. Okay, we have a question that came into the Health Education Service Facebook page. Is it important to only speak Spanish as the second language? If the first language of the applicant is another language than English or Spanish, isn't it useful to have a positive point? So I think the question is trying to get at if you speak another language, would that be helpful? And I think we can all agree that that would be extremely helpful.
Yeah, I think what's important to understand when you're speaking another language or when you have experience in another culture is just that there are communication issues oftentimes that arise when you have difficulty speaking a language, regardless of what the language is. There are cultural issues that you need to be aware of. As a healthcare practitioner, it's very important that you understand where somebody is coming from culturally as they enter into your office or enter into your chair. And so regardless of what language it is or what culture it is, there are a lot of similarities just in understanding and appreciating the value that all brings.
And kind of bringing this from the perspective of an advisor, Dr. Beck, how would you advise somebody who maybe is on, they took Spanish in high school and they're hearing this information from the dental school and the student really wants to get a leg up? What advice do you offer them to kind of start working on cultural competencies or, reaching out to other folks who may not speak the same language they do?
Yeah, I have encouraged people to learn a second language. I usually stress the importance of Spanish because of our growing population. But again, that could be any foreign language. And I think that that just adds to your cultural diversity personally. But again, if you're interested in a health profession, any health profession, you need to learn Spanish. That's there are interpreters, but there's nothing like speaking to your patient one-on-one and understanding what's actually going on, where the pain is, what's happening with that person. I have had students who had accompanied their grandmothers to their doctors or dental appointments and were the interpreter. And that has given them some inspiration to go into the medical and dental professions. But those who don't speak Spanish, I encourage them to learn the language.
And if I could follow up a little bit on that, Enrique, we're a dental school and we're going to spend a lot of time teaching biomedical principles and being a physician of the mouth and learning dental skills. Spanish is just a small part, but it's an important part. And we didn't dream this all up by ourselves. We're really proud of our medical school here, the Paul Foster School of Medicine. And not only do they teach biomedical sciences in a special and unique way, but they also insist on this Spanish. And so you're going to go to Spanish class for as long as it takes for you to qualify. If you come in, like Sid said, you can be very helpful and you can test out of this sooner rather than later. It's just 1 hour a week. And believe me, the rest of the time is going to be with just 3 other courses. The dental scientific principles of dentistry is the big biomedical course that you'll spend the first couple of years doing. The dental skills is another course all by itself. And then we have a course called Society, Community, and the Individual. And that's where we'll be teaching some basic public health issues and some research as well. So that's sort of the reason why now, just as Dr. Beckett said, you really can't go anywhere in the country now and be a healthcare provider and not benefit by speaking Spanish.
And I do want to add as well, for those of you that speak other languages, maybe English is your second language. I know that was my experience, where you should actually seek opportunities to improve your linguistic skills, to improve grammar, written forms of communication, and don't limit yourself to Spanish. You know, if you are a Vietnamese speaker, you know, Vietnamese is the third most spoken language in Texas. Any other language, again, is going to expand your cultural competence. So if you already have that in your tool belt and you're kind of hearing that you're going to continue to get help, go the extra step and figure out opportunities where you can continue to improve. And
I might add, if Enrique, if your school has a special class like in medical Spanish or
yes.
hospitality Spanish, those are very helpful. We have had that, or still have it, I guess, at North Texas. And it was an advanced course. So you need some basic Spanish before you take those courses, but it will allow you to learn the terms, the medical terms that may be helpful to you.
Mm-hmm. Thank you. So we got a few similar questions, but I'll address the one that's coming from one of our advisors, Shirley Anderson at UT Dallas. Hi, Shirley. Thanks for joining. With my students 9 hours away in Dallas, are you drawn to applicants that demonstrate an interest in learning languages or working or serving in El Paso after training? I think we've addressed the languages issue, but I think the larger question there is, you know, how students can show that they have an interest in working in the borderland.
So I think that, yeah, we definitely are, you don't have to just be from West Texas or the border area to have an interest in, but I think it's important in their application to be able to highlight some of the experiences that they've had, to be able to show that, yes, that is something that they've had an interest in for a while. You know, past behavior is going to be a predictor of future behavior. So if there have been a lot of experiences that they've had in college that sort of are drawn to those areas, then that's something that also needs to be highlighted in their application. El Paso is an underserved area. So there are lots of underserved areas throughout Texas. So it doesn't just have to be El Paso, but if they are interested in, and they've volunteered and done other things in underserved areas, I think that will also show us that there is some sort of a connection. And of course, if there's any sort of a connection to West Texas or border area, that's important as well. Sometimes there's families, sometimes there's, maybe they've come from a country that is a Latin American country. And so just being able to be in a place that is kind of reminds them of home is an important piece for them.
I think it's only fair to say that there are some wonderful people that are applying for dental school. They come from all over Texas. I mean, we're a huge state. We have some outstanding schools. And so we're going to have folks that come from Dallas and Houston and Austin for sure in our class. But we hope to be able to also attract folks with roots in Western Texas. That's for sure. That's part of Texas Tech's mission, and that is what Texas Tech Dental School is going to do.
Thank you for that. We have another question. Would students graduating from the Woody L. Hunt School of Dental Medicine have trouble specializing after graduating, since the dental school is brand new?
I really think that depends on the student and their interest when they're in school. Our job for sure is going to be training excellent general dentists, but that is not to say that we want to discourage anybody from going on from there to a specialty in a residency. I happen to be an orthodontist, I practice orthodontics in El Paso. That's where I'm from. That's why this is such an exciting time for me. But your interest in how well you do in school, how well you do in general dentistry, and then how much you are interested in, say, prosthodontics or endodontics or orthodontics or periodontics depends on you. And you showing an interest in those areas, you're going to be taught the basics in those particular areas. But if you want to specialize, we'll be here to encourage you and to help you. Sure, we're a new school, and sure, we've got to prove that our folks know what they're doing. But I think that you're going to find that we're going to be up to the quality of the other fine schools in Texas, and we'll have graduates that will be attractive to specialty programs.
I think if I could just add on to that, Dr. Black, you know, our program is set up to start with an earlier clinical experience, with the idea that, you know, by the time they finish their third year or entering into their fourth year, that last year, 6 months, is spent gaining confidence and speed in their techniques and looking at maybe areas that they do want to specialize and trying to get some more of those cases under their belt. And I think that that's a real important piece that we can add to that specialization.
And I think that's something that would be applicable to other health professions if there are any pre-med students or pre-veterinary students out there. But you know, it comes down to your what you put into it and how competitive you end up becoming. So we have some more questions that have been coming in. We really appreciate everybody's interest with all the questions that you have been sending. So here's another one. Howdy, we found the Aggie.
We know that they're from A&M.
I understand that the Texas Tech Health Science Center, we'll just say the Hunt School of Dental Medicine.
There you go.
Biomedical science program has conditions where students who meet a certain criteria within the biomedical science post-bac can have a guaranteed interview with a medical school. This is for the medical school then. Will this apply to dental school as well?
So I know that that is something that we have been looking into. Our biomedical sciences program is amazing and our dean is terrific, Dr. Raj. And so I know that that's something that we are exploring down the road. Can we answer what that will look like exactly right now? We can't, but we are exploring it.
Yeah, the Paul Foster Medical School has a few years on y'all. And that's
10 to be exact.
Yeah, exactly 10 years. That's right.
That's right. They just had their 10-year celebration.
Wow. All right. Well, we got another question here. Hello from Texas State. Hello. How will the curriculum be in comparison to other Texas dental schools? For instance, what are the courses for the first semester?
I'm happy to answer that. As I said before, I'll just reemphasize there's 4 tracks. One track is your studies the first semester in biomedical science. The other track is dental skills. The third track is society, community, and the individual. And the fourth track in that what we call SCI is embedded the Spanish. And the fourth track is called the colloquium session, where you learn a lot about ethics and jurisprudence and business. So your first semester, you're going to have 4 courses. What is very unique and will be probably the most unique program in the country when we open the doors is the way that our curriculum is integrated between your practical dental skills and what you're going to be learning in order to be called a doctor. Paul Foster Medical School teaches with symptom-based, clinical-based cases. And there's only about 5 or 6 medical schools in the country that teach this way. So when you're taught as the patient presents to you, for instance, a patient doesn't come in and say, I have I've got a disc that is anterior positioned on my left side here between my joint. They come in and they go, you know, my ear hurts really bad. The muscles hurt bad on the side of my head. And I went to the ear doctor and they said, it's going to be your chewing joint. And so that particular session, you learn everything about the anatomy, the pharmacology, the physiology, the histology of that particular area. And then we move on to some other particular symptom that you will be seeing when you practice as a dentist. So to me, that's a great way to learn. If I was going back to dental school or to medical school, that's the way I would want to learn. I don't want to go back to going anatomy at 9 o'clock, physiology at 10 o'clock, and do that for 2 years and then be thrown into the clinic setting and be asked to apply that now to a live patient. So you're going to be seeing a live patient within 6 weeks of starting, be seeing a live patient, and you'll be learning in that manner. And it's very exciting. It's going to be very unique. It is tailored to the national boards that you will take. We're going to be a very unique place until other folks begin to do the same thing, I think.
I was about to ask if the curriculum was influenced by the boards.
Yes. So
yeah,
we have a new integrated national board that will be coming on here next year, as a matter of fact. So, and that's the way that board will be set up.
Yeah. Thank you for that insight. We have some more questions that keep coming in. Keep them coming. We are a little over halfway through the session. Hopefully the technical issues mean that we can go a little bit past 2 p.m. if that's all right with you all. And then we will definitely stick around. And if you have any questions that we don't get to, please share them with us in our online communities, the TMDSAS Hub and the TMDSAS Non-Traditional Students Group. We have several folks, advisors, admission staff members, TMDSAS staff, and Texas Health Education Service on there to help guide any questions or concerns that you might have. As part of the last Courage session, I was hoping to get some input on the interview process for the Woody L. Hunt Dental School. Thanks, and looking forward to this new program.
So we had it all set up in the pandemic kits. So we are sort of in the process of possibly making some changes, but I'm just going to go ahead and speak off of what our original plans were. And our original plans were to have 3 different interview types. The first one is what we consider sort of a traditional interview, one-on-one, with a dentist in our community. And then the second piece would be multiple mini interviews, which would be situations that a student isn't ready to or prepared to answer, but sort of has to think out loud. It's not the idea of the answer, but it's really the idea of the thought process that we're looking for. And then the last activity would be a group activity. We know that collaboration is a very important part of our curriculum. And so we're looking at ways that students are able to work with each other. We also recognize that we are a group of, the first class would be 40 students. And so when you've got a small group like that, it's really important to make sure that that collaboration piece is there. We are currently, examining the pandemic and the situation and what that means for the fall as far as in-person interviews or virtual interviews. We're sort of preparing for both. We obviously would prefer that our interviews be on campus and in person so that we can really show off our campus, our new building, the SIM Center. But, if we have to do it virtually, then we will do it that way as well. I know virtually we are still planning on doing MMIs. And the last piece, the group activity, sort of trying to figure that piece out. so that we can get a whole picture of an applicant.
Yep. Excellent. Thank you. That should be of some guidance for a lot of students. You know, this isn't something that's completely new, the interview process. Several schools do MMI style interviews. And again, the running theme for this application cycle is that we have multiple plans running simultaneously, and we're just waiting to see what's going to end up happening. So as time goes by, you know, we will find out with better detail on what the interview cycle is going to look like, not just for your school, but for all of the schools. Okay, here we have another question. Do you have any changes in the average DAT or GPA for this cycle? Many applicants took the DAT before and got high scores, and many applicants will be taking during the summer. The stressful situation will cause our abilities to answer questions. Do you compare applicants with their DAT scores, or will you look at when the applicants take the DAT? So I believe the question's asking about folks that are retaking their DAT scores. I'm making some assumptions here, but I have heard several students who maybe had to retake a DAT and are hoping for a better score, but now they're kind of waiting on getting that test date set up. So what concessions is your admissions committee doing in accommodating those students? And then also maybe any advice that you all have with how DAT scores will be viewed in the review process.
So I think it's just important to get it out there that I think especially from us, I can speak for us, we really recognize the difficult situation that students are in right now. You know, nobody could have guessed that a pandemic was coming and was going to cause all of these issues. So from that standpoint, we were, even before the pandemic, the application is going to be reviewed contextually. Their academics are going to be reviewed contextually. Yes, we look at the metrics, but we also look at the other pieces of their experience that are important and can help them juggle multiple responsibilities at the same time. You know, being in professional school is like nothing else. You know, they're taking 20 to 23 hours of science classes. And so I think the point is that we are going to be examining everything contextually. So we will be looking at timing, we will be looking at the situation. And so it's not going to be just one piece that's going to be making or breaking their application.
Holistic review at play again.
Exactly. And we're going to be like the other Texas dental schools. In other words, our standards are going to be that high. It's very competitive in Texas for many, many reasons. One is the cost. One is the quality. And one is just the population that we have here that are Texas citizens. So remember that it's a very competitive situation to matriculate in the dental school. And the higher your grades and the higher your DAT, but also other factors are going to be in play.
And I think it's also important, Enrique, for students to sort of take advantage. I know, you know, many of them have had their date canceled and couldn't get another date until August or September. And so, you know, we are pushing back the beginning of our interview season into September to sort of allow for some of that. We will also begin reviewing applications. Interview invites will not be sent out until obviously we get a DAT score. But I think it's an opportunity for students to take another 2 or 3 months to study, especially now in the summer, right? With the idea that, you know, hopefully they're not taking classes, they've got some extra time, they're not doing a lot of traveling. You know, this quarantining can sort of give them the opportunity and the focus to really take that extra time that they wouldn't have normally gotten.
Absolutely. Hit all of those points really, really, really wonderfully there. Thank you. I think so many students are concerned about what's changing and they're not really focused on what's staying the same. You know, I think an applicant from last year would have given anything for 2-3 additional months to prepare for a test like this. And yeah, there are a lot of impacts that are very adverse in terms of getting experiences. You know, a lot of times students use the summer to perhaps do some shadowing or get some volunteer work. But there are other opportunities that have really opened up. And I think that using this time to study for those tests is a really key point. For those of you that are curious, and I know that Dr. Black referred to how competitive it is to apply to dental school. We've pulled the numbers over the past 10 years of the TMDSAS application cycles, and you can see the trends over the past 10 years for our 3 dental schools, of course. And now that we have 4, you can see how that pool is going to continue improving, especially if everybody takes advantage of the time to improve their DAT scores. And all of that data is available on the TMDSAS website under the plan section and applicant resources for this cycle. And on there, we have some additional statistics that will show you the ranges for the DAT scores and for GPAs. We do post the PA and AA scores for the DAT. And if you are a pre-med applicant, we also post the MCAT scores in a similar fashion. And for veterinary applicants, we do refer them to the Texas A&M school. And of course, next year, once the Texas Tech School of Veterinary Medicine joins us, we'll be doing some more robust statistical reporting as well. So just wanted to make sure everybody was aware of those resources that exist to show you kind of where you stand academically. So we have another question that came in. At this point, I probably don't even remember the material. It's been like 4 years since I last went to university. So it's somebody talking about their experience at their university. And so definitely the time to prepare for the DAT is going to be very beneficial for that person. All right. So we do have some questions about that Dr. Beck has found from her work with some other students. For the medical schools, they've actually defined a set of core competencies on a national level that essentially state what qualities the admissions committees are looking for as they're reviewing applications. The dental schools haven't had a similar project like that, but we're interested in hearing what kind of competencies or traits or characteristics the Hunt School of Dental Medicine is really looking for, and perhaps you know, digging into the influences that came into play for creating the mission and values for that school.
Yeah, so I spent a lot of time actually doing a lot of research in the dentistry world and kind of, you know, what characteristics were important for success, not just in a dental school, but success as a dental clinician. And we got together as a department and sort of brainstormed and really talked about what it is that we were looking for. And, you know, it's really interesting because we know that metrics, you know, in a traditional program, that metrics show success in the academic piece the first 2 years, but then there's these non-cognitive traits that are show success, you know, in those second 2 years. So finding that mix is what's really, really important. We know that we're going to have an accelerated curriculum. We know that we're going to be moving quickly. So it's really important that our students are ready to hit the ground running. So any student that has been out of school for a while, I'm going to highly suggest that they somehow get back into that world of studying, taking some review classes, those kinds of things. But as far as the non-cognitive traits, we know that dental school is very difficult, as is, you know, any professional school. So a lot of perseverance, a lot of dedication. We know that it's going to be leadership. And leadership can be defined in a lot of different ways. It doesn't just mean president of this or vice president of that. You know, we also, interestingly enough, put courage as part of our leadership characteristic because, you know, we recognize that we are a new institution and we recognize that we don't have the data behind us. And so it takes a certain kind of personality and some courage to be able to jump in and say, this is something that I want to lead and something that I want to be a part of and something that I want to set for the next 10 years for students who are coming into this school. And they have the opportunity to sort of set that culture, right, for the next 10 years. So again, those are just some of the traits that we are looking for, you know, as we get through this. And we know that students will have to be able to calm patients down in the chair. So some creative thought processes there, how to deal with situations, problem solving, you know, working with multiple pieces at the same time. Again, those are all very important pieces to being successful in our program, as well as being an excellent clinician.
I would just echo that and say that we didn't sit out here under a tree one day and decide, well, this is what we think is going to make a successful dental school. We visited the best schools of the country, a lot of the newest schools in the country, a lot of schools that were doing integrated teaching. It's still great that our bedrock, our model here is Paul Foster with symptom-based learning, but certainly there, for instance, there's only one 3-year dental school in the nation, and that is University of Pacific. And it is very, very demanding. So we decided we were going to be a 4-year school, but we were going to try to incorporate some of the University of Pacific's curriculum and calendar. And as Sid might have mentioned before, and I think this is going to be unusual, we are going to step it up and we are going to try to get our students to achieve the competencies that we think they need to have to graduate and to be licensed and to practice safely and independently. But we're going to also try to get that done so that your senior year, you're really spending either with the type of specialty that you're interested in, or you will be doing some advanced general dentistry as well. And so Sid is right. I think that we're looking for well-rounded people that we think at our school and with our committee that are going to make great clinicians and leaders in their communities.
Excellent, thank you. We have a few more questions that have come in. We have just under 10 minutes left in this courage session. So now's your chance and we'll hit these questions rapid fire if need be. Here's our next one. As someone from a border city, I love the mission of the school. I had a question about the public health curriculum in the first 15 hours. Is there an opportunity to complete an MPH jointly or post-dental school?
Yes, that is a great question, and that is exactly right. What we are doing with those first 16 hours is giving you the sort of bedrock courses for a master's in public health, epidemiology, your research project, biostatistics. They'll be in there. They're woven into a course called Society, Community, and the Individual. And it's going to be, it'll be a great course. And it will then, if you're interested in getting a master's in public health, you really have a great start. We're carrying this certificate from Hunt onto your next program.
Great, thank you. All right, let me make sure I'm not missing any. We have multiple pages that this is feeding into. So we have a question from the TMDSAS Facebook page. Can you talk more about the pre-match process? Since we are currently talking to a dental school, the dental schools don't participate in the pre-match process, but I would be glad afterward to address that question in our one of our online communities. And just so you know, we do have a section of the TMDSAS website that includes more information on the pre-match process, the deadlines for that, as well as a video for how the match process works for Texas residents who are applying to medical school. But as I mentioned, right now we are focused on our dental school, and we want to get those questions to them. Okay, so one key concern that a lot of applicants have right now is, as the pandemic has started to kind of unravel a lot of different types of industries, the dental industry was particularly impacted in that a lot of work had to be of an emergency situation. And so looking into your crystal ball, into what the future holds for students to kind of have some takeaways, maybe some qualities that they might want to start honing in on in a post-COVID world. Do you have any words of wisdom or some insights that you could share with a prospective dental applicant who's kind of seeing the situation and maybe a little bit scared about the future of dentistry?
Well, I think that's a great question. And I can only say that if you study history, you will know that dentists have always had to be protective of themselves, their patients, and their staff. And this is not the first pandemic that dentistry's had to deal with. We had to deal with terrible scourges like polio and the measles, and recently AIDS, the AIDS virus, certainly these latest. So personal protective equipment, personal protection, caring about patients and their health, and caring about your staff has all been part of really the basics that go on in a dental office every day. I think, as we mentioned many, many times, the health of your mouth affects the health of your body. For instance, if there's no one there to produce healthcare for your mouth, for your teeth, for your jaws, for your gums, that part of the body influences the rest of the body. So we're going to have dentists around for a long, long time. And just an example, if you have diabetes and you don't have clean teeth, your diabetes will get worse. If you have some sort of a cancer and you don't have a clean mouth and you don't see a healthcare professional on a regular basis, that your health is going, and that cancer will get worse. And so I think the future of dentistry is bright. And I think that it's still, to me, the very best profession in the world. And it's going to continue to be very popular, I predict.
I think also, Dr. Black, to add on, one of the pieces that we're doing, and I've heard this everywhere I've gone and to every dentist I've spoken to, is please, you're going to make sure that you include a business section in your curriculum. Because I knew how to do dentistry, but I had no And so I think more than ever, this is an important piece for students to understand that, you know, all of a sudden they get out of school and now they're actually making money. And there's some pieces to do to sort of protect themselves and their practice as they move down the road. And those are important pieces in the curriculum.
All right, we are down to our last question that has come in. Are the prerequisites going to be the same as they are for the other dental schools in Texas?
Yes, they are the same. The only piece that we are not making mandatory is anatomy and physiology. I believe it's mandatory for Texas A&M. That is a suggested course on our end, but currently it is not mandatory. And that's all on our website as well.
Yes, and we have links to that, to your website and via the TMDSAS website as well, and as well to the other dental schools that participate in TMDSAS. Okay, well, before we let you go, we wanted to give you an opportunity to address our applicant pool. Maybe give a final pitch for the Woody School of Dental Medicine, and maybe any words of encouragement to our applicants this cycle.
So I just like to say it's a difficult process. It's an arduous process. But if it's something that students are really committed to, and this is really what they want, they'll eventually make it. They may have to apply once, they may have to apply twice, they may even have to apply 3 times. But if this is something that they really want, I encourage them to continue to go after it.
And I would add, Sid, thank you, that this is a wonderful place to come to school. It's going to be an exciting school. It's going to be the newest school with the newest curriculum and the newest technology. If you think this is a traditional school, it's not. It is going to teach you the traditional skills that you need, but in the way that it's going to be taught, it's going to be very, very exciting. So we encourage you to give us a try, because we're going to have a great Hunt School of Dental Medicine. Thank you.
Thank you.
Thank you so much to both of you. And Dr. Beck, it's always a pleasure to have you. And thank you for giving us a perspective of your years of experience as an advisor. I think it's particularly important to help our students kind of figure out what their path looks like now, and then what it'll look like in the future. So I'm really thankful for having such a robust panel today. For those of you who are engaged with us on social media, thank you so much for joining us. Next week, we will have 2 Courage sessions again. On Wednesday, we will have the UT Southwestern Medical School joining us. And then on Thursday, we will round it out with having the UT Health Houston School of Dentistry. So we'll have hit all 4 dental schools in the Courage sessions. We're really excited for that. We hope that you will join us. And again, if you have any questions that come up afterward, especially those of you that are watching after today's live Q&A, we're happy to address any and all of your questions in our Facebook online groups, the TMDSAS Hub, which is open to any applicant, and the TMDSAS Non-Traditional Students Group. So on behalf of Texas Health Education Service and TMDSAS, we'd like to wish all our applicants all the best of luck. And again, thank you so much to Dr. Black and Ms. Goldfarb for joining us today.
Thank you.
Thank you, Enrique.